Understanding of the public health burden of sickle cell anemia globally and in India. Sickle cell anemia is a hereditary blood disorder characterized by the presence of abnormal hemoglobin, known as hemoglobin S. This genetic condition leads to the formation of sickle-shaped red blood cells, causing various health complications. The public health burden of sickle cell anemia is substantial, with significant impacts globally and specifically in India. Global public health burden prevalence. Sickle cell anemia is most prevalent in regions where malaria is or was endemic, such as sub-Saharan Africa, the Middle East, and parts of India. The World Health Organization, WHO, estimates that globally, approximately 5% of the world's population carries the sickle cell trait, with about 300,000 babies born with sickle cell anemia each year. Morbidity and mortality. SCA can lead to a range of health issues, including vaso-occlusive crises, organ damage, and an increased risk of infections. The disease significantly reduces life expectancy, and mortality rates are higher in low-income countries with limited access to healthcare. Economic impact. The economic burden of sickle cell anemia is considerable due to healthcare costs, lost productivity, and the impact on affected individuals and their families. Challenges in management. Limited access to healthcare services, particularly in low-income countries, poses a challenge in managing sickle cell anemia effectively. Access to essential medications, blood transfusions, and specialized care is often inadequate in regions heavily affected by the disease. Public health burden of sickle cell anemia in India. Prevalence of sickle cell anemia varies across different states. It is particularly high among certain tribal communities in states like Odisha, Chhattisgarh, Jharkhand, Madhya Pradesh, and Maharashtra. The tribal populations, such as the Gond, Bhil, and Oraon communities, often have a higher incidence of the sickle cell trait. Healthcare infrastructure. Access to healthcare facilities and specialized treatment for sickle cell anemia is limited in many parts of India, particularly in tribal and rural areas. Awareness and education about the disease are essential to facilitate early detection and management. Genetic counseling. Genetic counseling services are crucial in populations with a high prevalence of the sickle cell trait to help individuals make informed reproductive choices and reduce the transmission of the disease to the next generation.
Government initiatives. Some states in India have initiated programs to address the challenges posed by sickle cell anemia. For instance, the government of Odisha has implemented screening programs and offers financial assistance for the treatment of affected individuals. Challenges. Stigma, lack of awareness, and social challenges can hinder efforts to address sickle cell anemia effectively in India. The need for a comprehensive and integrated approach involving healthcare, education, and community engagement is crucial to mitigate the public health impact of sickle cell anemia in the country. In conclusion, the public health burden of sickle cell anemia is a complex issue that requires concerted efforts at both the global and national levels. Improving healthcare infrastructure, raising awareness, and implementing comprehensive genetic counseling programs are essential components of effective strategies to reduce the impact of sickle cell anemia on individuals and communities.